Hi, my name is Gabriela Casabona. I am happy to be here continuing our webinar about Dermapen. This is my conflict of interest, and I would kindly ask you not to take pictures of the patients I present here because not all of them authorize me to share their pictures. Okay, I'm a dermatologist since 2002. I started microneedling in 2006 with the roller because I had some patients coming from Europe and they were doing mesotherapy, and I thought, why not do drug delivery and not have the bruisings? So then in 2011, I started with Dermapen, which blew my mind because I could switch the depth of the needle without changing the tip. Then I tried other devices, stamping, rolling with vibration, RF with stamping, with ablative RF with the needles. But still, my preferred one is Dermapen, and I have the Dermapen 4, which is for me amazing, and I'll explain why. For me, it is a safe, cost-effective way not only to bring new collagen and elastin, but also, and for me, those two last ones are very underestimated, as a drug delivery system and a healing modulator. We can modulate the healing in fresh scars with this device. Why Dermapen is different? Dermapen permits you to have different depth and customize your treatment with the same tip. Promotes dermabrasion. For me, is one of the secrets. If we think about drug delivery, to have a little bit of the dermabrasion when we do the treatment. And the fourth generation is amazing because it's wireless and you can put inside a sterile glove and make a cleaner procedure. Science-based, let's look at science. So there are 11 publications on Dermapen, 2 with Dermapen only, and then 9 publications where it's used as a booster for other procedures in those indications below. One of the most important things is to understand injury, the level of injury you want for that specific patient and type of skin. So one of the things to decide the injury is the needle length. So in my clinic, I divide. You're going to see that the protocols I show here are a little bit more aggressive than what Dermapen market for general use as a lunchtime procedure. But just the thing is that I separate those mild procedures for my esthetician and I do medical procedures. So up to 1 is her procedure, up to 10 passes is her procedure. Everything that is beyond that is my procedure. So Emerson, a friend of mine from Brazil, divided the injury in mild, moderate, and severe. One of the things you have to look at is the needle length. So the deeper you go, the more aggressive you are for the different indications, but also density, number of passes. So I came up with density. Why? Because if you look at CO2, this is how we classify. How much dense do I need to go or to be? So that tells you how, I can have a very shallow treatment, but very aggressive in terms of passes. If I use 0.5, 20 passes, I'm aggressive too. So you have to understand the type of skin, the type of injury you want to do, according to the indications also. Another thing is a drug delivery. It was a big discussion 6 years ago, if it penetrates, doesn't penetrate. So let's look at science. Sasaki published a very good publication on microneedling. He looked at depth of penetration with H&E, with the biopsies, and also the presence of pigments, if it penetrates, it doesn't penetrate, and the inflammation, looking at the stain platelets, okay, in the PRP, when you do with PRP. So for her, relevant here is very interesting publication to read, relevant for us. He found out that 0.5 to 1 millimeter, the penetration is consistent. From 1.5 to 2.5, less even the penetration. And also the ideal timing to massage and get the penetration is from 5 minutes to 30 minutes. So it's not right away. I did this. So I stamped with Dermapen, the liquid, before and after the Dermapen, to see if it would penetrate, if only with the stamping. And here is where I think the dermabrasion makes a huge difference. So you can see in the biopsies I did in fresh skin after abdominoplasty that I couldn't see any vitamin C penetrating. I stained with ethylene blue. On the contrary, if I put the liquid and put the Dermapen on top, I can see penetration, and it's very even. So my assistant at the time, I compared roller and Dermapen, and it was interesting because you see that the dermabrasion part of the equation really makes a difference in the outcome. So if you compare roller to non-roller, you see that it's much better result on the right side than the left side. And this is just one treatment. And this is the chest. Indications: active acne. I don't normally treat active acne. This patient had a treated, was under antibiotic with topicals for 6 months, but those pimples, the chronic, chronic papulas, and also some red scarring, she was very concerned. So I did 3 treatments monthly, and this was the result. And I combined with right away 10% salicylic acid. Mild acne scars, aggressive treatment. You see that I treat more aggressive the acne scars, and then the surroundings less aggressive. I did two treatments in this patient. She was very happy, and she had done many lasers before, and she wasn't happy. Not as happy. I mean, everything built up, of course, but it's a very good procedure, very safe. I only had 2 complications in my whole life. I have more than 1,000 cases treatment, few including body and face areas. So this was a patient that had Sculptra before, injectables before, lasers before, but he wasn't happy about the results still. So I tried Dermapen 3 sessions, and he was much happier. Patients with botulinum toxin, with reminiscent wrinkles, what would I do? Filler, for me, is the best procedure. But if you don't want to do filler, what can you do? CO2, maybe. This patient wouldn't want such a long downtime for this. So I decided to do Dermapen, aggressive treatment. She's in the next day, and this is 3 months after. So you see that you can improve very much with low number of sessions, just 1 session. If you see in the middle, there was some bruising. This is normal. It can happen when a patient is old and has some telangiectasias. Melasma, my favorite procedure. So left side are the vessels, right side are the mixed melasma, dermoepidermal. And this patient was complaining about the rebound after all the lasers and peelings she'd done before. So I used the tranexamic acid and vitamin C to treat her 2 sessions every 2 months, because melasma has to be a little bit more apart. And this was the result. So I was very impressed with the vessels, especially. You see that when you thicken the dermis, you can improve the vessels. So the melasma is less reactive. And this is in the middle of the summer in Brazil. Stretch mark. I do use Dermapen only, but only in very few cases of very mild stretch marks. This is the protocol I use. I combine normally with non-cross-linked hyaluronic acid. This is my perfect one. So for thicker and deeper stretch marks, you need something more for the atrophy. Dermapen only is not enough. So I decided to combine with calcium hydroxyapatite dilute, and this is the end point with the Dermapen. You see I'm very aggressive. And this is a pathology. So you see that you still, with only microneedling, you can have a lot more collagen and elastin. But look at the papillary dermis, how thicker, how much more thick, and the regain of the regis. It's very important in the elastin that you get very superficial. This is key to get atrophy improved. So those are some cases, 3 months, 12 months after. This is 8 months after. Alopecia, I do use. I combine normally with mesotherapy or microneedle with some drugs like finasteride, dutasteride, minoxidil, PRF, and PRP. So I would only recommend to be careful with the number of sessions you do per year, because you can scar the scalp with this. Old surgical hyperpigmented scars. It was a patient that had lasers before, Fraxel and CO2. She got hyperpigmented. She was very unhappy. This was 2 years after the abdominoplasty, and this is 1 session of Dermapen with vitamin C. Hyperpigmented scars also make it better if you do it as aggressive. I think you recruit the skin and you make a new skin on top, and the atrophy was much better. So can we modulate the healing or not? So here you have the chance to enhance the TGF beta, the VEGF, the PEGF, all the growth factor can be enhanced in this very early phase. Also, if you combine with microtoxin, which I did and I published, you can control the number of myofibroblasts you have. So what I want with the role of microneedling in this is specifically to enhance the TGF beta, the extracellular matrix in the end, by enhancing also the migration of fibroblasts, by enhancing the PDGF. And the end result is a more even deposition of collagen. So I look back, 35 patients that I treated and 35 that I didn't treat after Mohs surgery, flaps on the face. And I did 2 treatments of Dermapen 15 days apart. And this is how I diluted the toxin. This is how I injected the toxin, 5 millimeters apart around the scar the day I took the stitches out. And this is how I did the Dermapen 20 to 30 passes. This is the patient the day I took the stitches out. This is a month after. Maybe if you would wait 6 months, it wouldn't make a difference. But who wants to walk around with a very red scar like this patient a month after she still had very marked scar and more or less and was operated by me. So I guess the technique was more or less the same, the quality. This is another patient. Even I had a necrosis in this case, and you see how much better he is in the month. And this is a patient that I didn't treat to see more or less the same flap, very thin skin with this patient and the other one, that you can have different outcomes. And this is the patient after the treatment that I decided to do. So take home messages: injury, decide the depth and the density you need to get. Be careful with dark skins, be careful with Asian skins, don't be too aggressive. To guarantee penetration in a small area you want, like acne scars, surgical scars, or stretch marks, stamp in the depth you want, and then you move around. Those are the indications we commented before. Protocols: if you're doing direct delivery, what works best is to combine the liquid, the Dermapen on top, and then massage in between 5 and 30 minutes right after. The Dermapen in between 5 and 30 minutes, and always treat the whole area. Those are my tips for you. Thank you for coming and staying with me. And we have to learn how to look beyond. Thank you so much.